Sleep apnea is a sleep disorder in which pauses in breathing or periods of shallow breathing during sleep occur more often than normal. Each pause can last for a few seconds to a few minutes, and they happen many times a night, causing individuals to partially wake up multiple times during the night as they struggle to breathe. Symptoms of sleep apnea mainly happen while you sleep. They include breathing stopping and starting, making gasping, snorting or choking noises, waking up a lot, loud snoring. During the day, you may also feel very tired, find it hard to concentrate, have mood swings, have a headache when you wake up. It can be hard to tell if you have sleep apnea. It may help to ask someone to stay with you while you sleep so they can check for the symptoms. Sleep apnea is usually treated with a mask you wear while you're asleep CPAP machine. If you have been diagnosed with sleep apnea, there are some things you can do to help. These may be all you need to do if your sleep apnea is mild. Do try to lose weight if you're overweight and sleep on your side. Try taping a tennis ball to the back of your sleepwear, or buy a special pillow or bed wedge to help keep you on your side. But do not smoke, do not drink too much alcohol, especially shortly before going to sleep. Do not take sleeping pills unless recommended by a doctor. They can make sleep apnea worse. There are 3 types of apnea: obstructive sleep apnea disorder (OSA), central sleep apnea disorder (CSA), complex sleep apnea. The most common type is called obstructive sleep apnea. Obstructive sleep apnea is in which breathing is interrupted by a blockage of airflow. Central sleep apnea, in which regular unconscious breath simply stops, or a combination of the two. OSA has 4 key contributors. These include anatomical compromises like a narrow, crowded, or collapsible upper airway, or non-anatomical ones like an ineffective pharyngeal dilator muscle function during sleep, airway narrowing during sleep, or unstable control of breathing. In central sleep apnea, the basic neurological controls for breathing rate malfunction and fail to give the signal to inhale, causing the individual to miss 1 or more cycles of breathing. Doctors have more recently identified a 3rd type of sleep apnea called complex sleep apnea, which is a combination of obstructive sleep apnea and central sleep apnea. Patients with this type of sleep apnea may at first seem to have obstructive sleep apnea, but unlike typical patients with obstructive sleep apnea, these patients' symptoms are not fully addressed with the use of CPAP. This condition can affect anyone, but some things put you more at risk: being overweight, a large neck circumference that could make your airways more narrow, a narrowed airway that you inherited or developed from large tonsils or adenoids, being male, older age, smoking, use of alcohol, sedatives, or tranquilizers, nasal congestion, conditions such as type 2 diabetes, heart failure, high blood pressure, Parkinson's disease, COS, hormonal disorders, prior stroke, or chronic lung diseases. With halotherapy, sleep apnea can be controlled. When dry salt is inhaled deep into the lungs, it lines the walls of the airways and helps loosen congestion. This creates a clean respiratory system, which promotes easier breathing and a relaxed sleep, while also reducing snoring. Speak to us to know more on how you can combine various treatments and devices.